In this video, we will be talking about 10 early symptoms that will help you determine the onset of diabetes. Pay close attention to all these symptoms in order to be sure and take precautionary measures so as to control your blood sugar levels. So, let's get started. Number 10. You urinate a lot. If you find that you are urinating more than you used to normally, it can be a matter of concern. There are innumerable causes for frequent urination, but it is always better to keep a track of changes happening in the way your body functions. Diabetes is when our body fails to generate or utilize insulin, the hormone responsible for drawing glucose to the cells. This condition can increase the sugar in blood to an undesirable amount. It is a known fact that plenty of sugar is not good for the kidneys, and eventually, the excess glucose is removed from our systems in the form of urine. Not only that, but other essential fluids also get discharged, which makes one feel dehydrated. Peeing a lot straight away indicates type 1 and type 2 stages of diabetes. Just monitoring the fluids you take in and counting your bathroom visits will not act as a solution. In this situation, one should immediately consult a doctor to be prepared in advance. Number 9. Your skin becomes very dry. Diabetes can bring with it a variety of skin problems. One of them is the drying of skin, making it very itchy. This occurs due to the mixture of high sugar levels and improper circulation of blood within the body. In such cases, the skin becomes dry to such an extent that it flakes off and becomes susceptible to infections. The best way to prevent this is to find out the cause and get to know more about the complications and how to reduce them. You should keep your skin clean at all times, especially the areas like armpits, groins, etc. And never forget to moisturize after taking a shower. Number 8. Your vision blurs. The vision is said to be blurry when you cannot see the details clearly, and when you try to do so, the eyes become watery or they start hurting. The high sugar level in blood can affect the tiny blood vessels within the eyes, eventually causing a blur vision. The scientific term for this disorder is diabetic retinopathy. It mainly includes 4 stages starting from mild to proliferate retinopathy. The quick fix for blurry vision is to use eye drops or a new pair of eyeglasses. Early consultation and treatment can prevent a major problem that can potentially cause permanent blindness. Number 7. Your hands and feet get tingly or hurt. Diabetes has a direct impact on the body's nervous system and can severely damage the nerve endings, especially the hands and legs. You might have heard diabetic people complaining about how they sometimes feel the numbness in their hands and feet. This condition is known as diabetic neuropathy. In some cases, it can even cause permanent disability in a particular body part. Regular blood sugar monitoring can work in preventing the neuropathy or at least slow down its growth. The main type of neuropathy is peripheral, autonomic, proximal, and mononeuropathy. American Diabetes Association says that the screening for any neuropathy should start right after someone is diagnosed with type 2 diabetes. Proper management of sugar levels and taking care of the feet are 2 highly recommended ways to prevent this condition. Number 6. You are always thirsty. This symptom might seem to be an obvious one, and it actually is. If one symptom says that diabetes makes a person urinate more often or more than usual, another symptom that can be noticed definitely is always being thirsty. It is obviously because the body has as no good as no hydrating fluids after peeing. Because of the dehydration caused, you can also feel that your mouth is all dry. What happens is that the kidneys are forced to produce more and more urine to be eliminated as it contains extra sugar in it. Your brain will tell you to drink more and more water after urinating every time, and this will in turn cause you to pee more. This problem will require you to follow the medication strictly. You will also have to take regular blood tests to monitor the sugar levels. Number 5. You unexpectedly lose weight. If you discover that suddenly you have lost a considerable number of pounds, there is a chance that diabetes can be the reason. The 2 primary reasons for this are increase in fluid discharge from the body and decrease in the generation of energy from the cells. If enough attention is not paid to this symptom, it can lead to shrinking of the body and weakness. The insulin in the body hinders the utilization of glucose to produce energy. Due to this, fat starts burning, causing reduced weight. This symptom is commonly observed in people with type 1 diabetes, but it is also possible in type 2. Losing or gaining a couple of pounds over a period of time is considered to be normal, but a sudden decrease of approximately 5% or more should not be ignored in any case. Number 4. You form dark patches. Not only dry skin, diabetes also causes the formation of dark patches on the body, especially where our skin gets folded on itself. The scientific name for this is acanthosis nigricans. These are nothing but variations in pigmentations that can be found on the groin's neck region. Research suggests that almost 55% of diabetic patients experience these discolorations. It is also said that there is no specific treatment to treat them, but the smallest occurrence itself can lead to major complications like diabetic belay, diabetic chiroarthropathy, necrobiosis, lipoidica, and many more. Additionally, patients can also develop recurring fungal infections. This shows us how most of the early symptoms of diabetes are directly visible on the patient's skin. Number 3. You are hungry all the time. In case of diabetes, all the food that you eat does not get used by your body to generate energy out of it. Considerable amount of glucose does not constitute the circulating blood, but the cells fail to absorb the same. Due to this, you tend to starve frequently. The pancreas in our body thus increases the insulin in our body and we feel hungry. Talking about uncontrolled diabetes, wherein the glucose level in blood remains very high, the condition is called hyperglycemia. On the other hand, when the glucose is really low, it is termed as hypoglycemia. Just eating more and more food might not solve this problem. The reason being that, although there is food entering the system, there is no energy produced, which eventually results in weakness. An effective way to tackle these disorders is to start insulin or sulfonylureas medications to cover up the deficit and try to balance between hypoglycemia and hyperglycemia. Number 2. You heal slowly. The process of healing from any sort of injury slows down when one has diabetes already. The general recovery speed reduces because of the deficit we talked about in the previous symptom. We all know that healing or recovering requires all body cells to multiply and use the supplied essential nutrients to produce useful energy. In such a situation, even the smallest cuts can take weeks or months to heal, and this increases the chances of various skin infections on and around the already affected area. Science says that diabetes mellitus is one of the most common causes of slow wound healing. Other causes include low human growth hormone, rheumatoid arthritis, and zinc deficiency. Therefore, it becomes crucial to control the blood glucose level. Another important suggestion is to keep a check on hands and feet for any kind of cuts or wounds. If a person does not have diabetes but he or she takes unexpectedly long to recover or shows any sign of skin infection, it is important to visit a doctor or a health professional. The most terrifying consequence of slow or no healing in the case of a diabetic patient is amputation. Number 1. You get yeast infections. You might be surprised to know that a small amount of yeast is already present in your body. Not only you for that matter, it resides in everyone's bodies. For a person suffering from diabetes or showing symptoms of the same, the extra quantity of sugar present in the body acts as food for the yeast that results in more yeast growth. This gives rise to yeast infections. Thus, over here as well, maintaining blood sugar levels becomes necessary. The individual should undergo regular checkups without fail to know the extent of yeast overgrowth, if any. Back then in 2007, researchers found that more than half of diabetic patients develop a common type of yeast infection. Following the prescribed medication is always recommended in such cases. In all the above early symptoms we saw, it can be concluded that things can lead from one thing to another in the cases of diabetes if attention is not given to it. If you experience any of these symptoms, you should know that it's still not too late and there's still room for improvement. Like the video if you like the content and share it with your loved ones so that this video can help as many people as possible. Lastly, subscribe to the channel for more such useful videos.